Thank you. I can only say very little in Indonesian. Salamat sore. Now it's all in English. I apologize. So today, very briefly, I would like to introduce to you a very new development in public health. I want to talk a little bit about a critical public health of traditional medicine. This is an area which has been developed by myself and colleagues for about 15 years in Australia and in the UK. And I'm very, very honoured, and thank you very much to IACME for inviting me here today to tell you a little bit about what we're doing in public health. New slide, please. Thank you. So let me just begin at the beginning. Why do we need a critical public health of traditional medicine? Well, not just here in Indonesia, but also all around the world. Traditional medicine is incredibly popular. It's increasingly used, even in Western countries such as Australia and North America. And of course, it's often the dominant, or in some cases, only healthcare that certain patients and populations will access. And I would argue that that alone makes this a topic which public health research and scholarship needs to start to engage a little bit more seriously with. Another area, of course, another issue, is the development and the emerging presence of traditional medicine in terms of a whole range of areas of chronic illness, global health issues, whether it be malaria, whether it be TB, and of course back in Australia, chronic diseases, cardiovascular, mental health, depression, and cancer care. One of the problems that I think public health internationally has had with this topic, people have often started from a notion of efficacy or a notion of effectiveness, and they've been, quite rightly, interested in randomized controlled trials. One of the problems of only being interested in randomized controlled trials is that we often, to our detriment, forget about all the other methodologies and disciplines in public health research which are equally important to investigating traditional medicine. In Australia, I can only speak for Australia, in Australia this topic is very, very popular, very emotive, and often both sides of the argument don't refer to science. They refer to emotion. So we have often the medical profession, or certain parts of the medical profession in Australia, who critique traditional and complementary medicine simply because they say there's no evidence. Equally, or in contrast to that, we have people in traditional and complementary medicine who don't appeal to science and evidence. So we've got a miscommunication between the two. And one of the things that I think public health can do is provide a middle ground. It can think about this topic in terms of rigor, in terms of science, and in terms of providing validity, credibility to this topic. Next slide, please. So what is needed? How do we go about developing a public health, an international as well as national and local public health of traditional medicine? The first thing I think we need to do, we have to make it critical. It has to be a non-partisan approach to understanding, examining this topic, but it has to be one which is based on science and based on all the practices and all the methodologies we already currently use in public health, whether it be epidemiology, biostatistics, qualitative research, health economics, the list goes on and on and on. The other thing is that we need to explore traditional medicine probably not just in terms of its use in the community and in terms of it as a treatment, but think about it in a public health way as another vehicle for health promotion and another vehicle potentially for for illness prevention in the community. And most importantly, I think we need to think about this topic in terms of research capacity. This is a relatively new topic for public health to be thinking about systematically. We've had lots of work done on this topic over the years, but it's often been done by individuals in little silos. It's often fairly ad hoc, and it's not been a comprehensive, if you like, an agenda, a vision of how public health can engage with this topic. Next slide, please. So here's the core ingredients that underpin a lot of the work that I'm doing in Australia, and also many colleagues, including people here in EACME, are also doing at this moment. First is to provide a balanced approach. What I mean by balanced is we don't treat traditional medicine as inferior to other forms of publicly funded or provided medicine. For the sake of research, we treat them as the same. We have to do that so we can explore them in the same way. Otherwise, we've become political rather than science. Linked to that, of course, is an impartial approach. We need to make sure we're providing that middle ground that I spoke about earlier, rather than be pro one thing or pro another. I'd just like to make this clear at this point. I'm not here being an advocate for traditional medicine, and neither am I being an opponent of traditional medicine. I'm just suggesting that public health needs to take this topic seriously in terms of scholarship, research, and examining it. That's quite important to make that clear. And also, of course, what public health brings is a notion of critique, critical methods that are tried and tested, that can provide us with this science. Just to let you know, the research program that myself and my centre has been developing in Australia now for 5, 6, 7 years. The reason why, fortunately, we've managed to get quite a lot of money from the Australian government to fund our activities, over $8 million, is because we take a critical approach. We're the only group in Australia who are researching this topic with these ingredients. Many other people in Australia are interested in this topic in public health or in other areas, but they are not a group of methodologists like the team that I lead. And finally, of course, and very much in the ethos and spirit of EACME, this research and this investigation has to be about translation. It has to be about an impact for patients, policymakers, practitioners, and the community's health. That's vital. Next slide, please. Thank you. So just some thoughts about what we might do, and some of the things that we have been doing in Australia, just to give you some examples. When I meet people in complementary medicine or traditional medicine in Australia, one of the first questions I ask is, what do we know about what a complementary or traditional practitioner does? Or what do we know about a patient and their behaviours in using traditional medicine? And unfortunately, the answer is often, we have an anecdote. People have anecdotal evidence, but we have no epidemiological data. And this, from my perspective, is the start of the public health of this topic. We need to know what people do when they practice these medicines. We need to know why people use them. We need to know the interaction, the communication between those different partners. And we need to do all this with an eye on the quality, safety, and effectiveness of the healthcare for the community. And just to let you know, the research centre that I lead in Sydney, University of Technology Sydney, is a multidisciplinary centre. And I think that's exemplary of what the approach needs to be. in public health of traditional medicine. We need to draw on all the methodological skills that we have here in the room and that we have at places like IACME, across public health departments in Indonesia, and also the same in Australia. Next slide, please. So to give you just a brief introduction to some examples of research that can be done, I'd like to just cherry pick one or two of these off and just give you some evidence of research we've been doing in Australia. And you can easily translate this to thinking about research questions and designs for Indonesia in terms of traditional healers, jamu, and other such practices. We've just finished the first ever national and nationally representative cohort study of pregnant women in Australia. Nearly 2,000 women have been surveyed about their use of traditional complementary and other maternity care services. And our results have been quite staggering. We found that nearly 2/3 of Australian women use a complementary or traditional medicine during pregnancy. And more importantly, nearly half of those women do not tell anyone about that use. They keep it to themselves. Instantly, my public health brain tells me that this is an important issue. There's a safety issue, there's a science issue, there's a community health issue. The other piece of research, another piece of research that we've been done, all funded by the government, has been looking at the difference in access to traditional and complementary medicine in Australia across urban and rural Australia. And it may come as no surprise to you, but we've now got the first ever nationally empirical data to show that women in Australia are statistically more likely to use complementary traditional medicine if they live outside urban cities, if they live in rural areas. So then part of our study was to ask, why is this? So we did a series of qualitative investigations, and one of the main reasons that came was a lack of access. People in the bush, people in rural Australia, often it's a challenge to find a medical doctor, particularly a family doctor, a GP. So people are searching for alternatives. And I know that in parts of Indonesia there will be a similar scenario, if not even a different scenario, where there is no family doctor. I saw some slides earlier about the number of family doctors or the number of doctors per population, and it varied a lot based on province. And I suspect, obviously, it varies by area too. Another topic which we've been highly involved in Australia, and I think, again, it provides a nice partnership with Indonesia and thinking about traditional medicine here, is looking at health policy, thinking about legislation, regulation, standardization. In Australia, there are many complementary traditional practitioners who practice completely unregulated. So the patient and the public health system does not know what they're receiving in their care. And this is something in Australia that our centre is starting to research, starting to make policy recommendations to government. Next slide, please. So quickly, because I realise I don't have too much time, I'd just like to tell you a little bit about some of the developments in this topic, and I suppose why I'm here. Why come to Indonesia? Why talk at an IACME congress or conference? Well, the reason is because there is already development and collaboration. The other thing I haven't told you is that I am the national convener on this topic for the Public Health Association of Australia. So finally, the Public Health Association in Australia is taking this topic seriously and this research agenda seriously. And I'm very pleased to say that we're looking forward to continuing collaboration and partnership with the IACME, but also with the American Public Health Association, who also have a special interest group on this topic. So finally, it seems to me, we're in a nice space. Public health has started to take this topic seriously. It's thinking about an agenda, and I think if we do move forward thinking about these types of core ingredients and core, if you like, I suppose, what would you call them? They would be the core things that we need to think about when we do investigate this topic. It needs to be rigorous, it needs to be critical, it needs to be scientific, it needs to be impartial. And I think that's what governments want to hear. They don't want to hear us tell them, this might be quite good, we're not sure. We need to investigate it, we need to know why it's being used, we need to know how it's being used. Next slide, please. This is a text which myself and colleagues have edited. It came out last year. This is the first international reader in traditional, complementary and integrative medicine. This is a collection of 32 chapters, pretty much outlining in detail a lot of the things that I've discussed today. There's health economics, there's a public health agenda, there's a health geography agenda, there's a clinical agenda, legislation, regulation. So I do think that there's a lot of optimism. I do think we should be optimistic. And I do think that finally we're in a position to study something which, to our detriment in public health as researchers, we've often thought about, we've often even researched, but not systematically approached as a new topic. That's the new ingredient. This is a comprehensive vision for how to look at this topic. Thank you again for the wonderful opportunity to talk today. I'll keep it brief. Thank you very much. Thank you.
Thank you very much.